Good morning, everyone. I'm Sayukta from Beautiful Spotless Skin Team. You must have come across people, especially women, with brown colored patches on their face. They seem like like spots forming large flat patches. This is nothing but skin pigmentation. In India, according to a study conducted across 4 Indian cities, revealed that more than 80% of the population's present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. Several things about sunscreen that we people are not aware of, and that makes us not to include sunscreen as an integral part of our skincare routine. So let's connect today with our skin expert, Dr. KNS Sailaja, live from Rajahmundry, to enlighten us on the topic of importance of sunscreen in melasma. Dr. Sailaja is a consultant dermatologist and cosmetologist at Sailaja Skin and Hair Clinic, Rajahmundry. Dr. Sailaja has done MBBS from Vaidehi Institute of Medical Science, Bangalore, and MD DVL from Ashram Medical College, Eluru. She also worked as assistant professor in Department of Dermatology in Ashram Medical College. She has done presentations at various conferences as student of dermatology and won awards as well. Also attended different aesthetic and cosmetic workshops. A very warm welcome to you, Dr. Sailaja. It's a pleasure to have you with us for this session.
Thank you.
So, Doctor, today we are going to talk about pigmentation. We are going to talk about melasma, importance of sunscreen, etc. Now, please tell us about pigmentation and why it happens, because we see a lot of, patches, freckles, spots on our skin, but we don't know what it is exactly.
Hi, first of all, hi. Thanks for everyone to logging in with us. Basically, I just want to say that a little ignorance about the lesions or skin is the main cause for all this like pigmentation over the face actually. And based on the climatic conditions and temperatures of India, particularly our area, the pigmentation is more. There are few things called genetical and few called like they are acquired. Any pigmentation in anywhere in the body. Genetical is something at birth, not necessarily at birth like day one, but at least like within the few years of their childhood it starts. Acquired is something because of whatever we come across in our life as we grow, like sunlight or any other like applying many cosmetics on your skin or any burns or whatever it is, any chemicals contact. So these are all got acquired. Basically, so first if we know if we know what is the cause for this, what is the root problem for this pigmentation, it will help us to treat it. So as you said, to highlight the melasma, melasma is nothing. This freckles, melasma, everything are a result of sunlight and its radiation on human skin. So I think basically every one of us know that compared to other Western countries, we have a melanin production more in our body. That's why we are little tan. We are not like very fair, like white. We are always wheatish, like mostly, not very few exceptions. We are wheatish, different tones of wheatish. So whenever we are exposed to sunlight, what happens is our body normally if it produces. I'm trying to make it simple for everybody to understand, not so much of medicine. So if when we are exposed to sunlight, our cells will have few things called melanocytes. Melanocyte is something which produces melanin. Melanin is the pigment which gives us darkness. So whenever our skin is exposed to sunlight, our number of melanocytes increase and the production of melanin increases in our body. So when this happens, you can see freckles, you can see this melasma. Melasma is nothing but pigmentation. If you see, it will be mostly present over the nasal bridge, along the malar area and forehead, that too specifically over our temples. And sometimes it can be seen in the upper eyelid also. And if ignorant and if you didn't take proper care, it can be spread to like other areas also, wherever there is sun exposure, like hands also pigmentation can be seen. So the main culprit here is sunlight. And one more common doubt we see from the patients, they tell, madam, everybody gets exposed to sunlight. Why am I only getting? My friends, we all go do everything together. Why I am getting melasma? Why not others are getting? So there is some hormonal component and also predisposition also in us. Like we are few people have very sensitive melanocytes, which within like it fastly they start producing melanin. And hormonal around 40, our females will have this hormonal surge again up and down. So during this time also, then we can see melasma.
That's why it's quite common in women's due to all the hormonal changes,
And one
etc.
more point I would like to add again. So in pregnancy also, generally, because whatever the hormonal, pregnancy is like full jumble of hormones. So during those time also this starts, and it is called cloasma. Many would have suffered, but generally after pregnancy this subsides. But for few people it won't subside. It will continue through the life.
Okay, so if during pregnancy pigmentation is taking place, then it's a matter of concern because otherwise it will, in most
Yes,
of the cases it will fade away.
yes.
But
Because
is it important to go and consult a doctor?
no, generally, if due to apprehension, you can definitely ask your gynecologist. But if you're very much worried, you can definitely go to a dermatologist. Even the dermatologist won't suggest you much of a thing. Like basically, they'll just tell you it's common, like general counseling. See what happens if I tell don't go to any doctor, it's okay. People will start taking the drugs from over the counter, like these painless things and all, and they'll
Right.
sleep further. If they just go to a dermatologist, they'll clearly explain it's nothing more, it's common, it will come down. If it didn't come down, in case if it's not gone, you can always come to us after the delivery, we will treat it. So that counseling is also actually very important. We don't want them to spoil it further. That's it.
Exactly. So we need right kind of counseling, and for that we need to go and consult a doctor rather than going to the chemist and buy over-the-counter medicines.
Yes, definitely.
Doctor, who are more prone to pigmentation?
In our there's a dictum that around 40 and the people who are more exposed to sunlight and who are having the hormonal like diseases like hypothyroidism with the hormonal and PCODs and hormonal imbalances, these people are more prone to have any pigmentation anywhere in the body, not only melasma, any other pigmentation also.
Okay, and which type of skin is more prone to pigmentation?
See, the types of skins are generally like I think you're asking like oily skin, dry skin.
Yes, yes.
I don't think there is no any study or anything based on the type of skin where you can generally say like which gets affected. But definitely there are another classification of skin that is like Fitzpatrick 1 to 6, like 1, 2, 3, 4, 5, 6. For you to understand, I can say one is a Western European fair skin, and six is like a very dark tone, like African, something like that. So we are Indians are always in the 3 and 4. Even the fairest Indian also will be 2 and 3, not like one. We are not one. So like that 3 and 4 is common, and we people are more susceptible to this.
Okay, all right. And we also have people who have very sensitive skin. So are they also equally prone to
Yeah,
pigmentation?
sensitive skin people, what happens is they're mostly, yeah, one because of sunlight or anything, they'll get affected. Definitely, they'll. But the main problem is usage of unwanted chemicals on the face. They react faster, and when they heal, it heals with blackish pigmentation. For example, if any kid or any student, some small child, if he falls down and he has a bruise or cut, like whatever trauma, it will heal with first black, then white, then slowly it will become dark, and then it will come to normal. It will take its course. So if you're injuring your skin also at micro level, that is like applying unwanted creams or anything else. It's not wantedly, but you will also want to try. Even I try many things and I would find, oh shit, this is not for my skin. But what happens if they're sensitive and dry skins, basically dry skin and sensitive skins, this pigmentation will form due to this unwanted applications mostly, and also like all the other things which are common for other skins also.
Right, right. Okay. You also said that sun is the main culprit for pigmentation. So those who are exposed to sun or more exposed to sun are more prone to pigmentation. Now, my question is, we all know that sunscreen is one thing that actually protects us from sun and other, light sources that are harmful for our skin. So
Yes.
how does sunscreen protect the skin from pigmentation?
Yeah, before going into sunscreens, I just want to tell one point. Like from few people come to us, and for one more thing, I think I was not clear before. It's on my part. Melasma is more common in females, but it's not that it can't occur in males. Males also have melasma.
Right.
I wanted to clear that, maybe it came out wrong. Second point, this when I say exposure to sunlight, what would you understand? You think that if I go out, I'm a daily labor, or if I go out on any work, then that is sunlight exposure. I am a doctor. I sit in my AC cabin whole day, but I will be under this LED lights, tube lights, computer, phone screen, and if I sit just like this from the window, UV the radiation passes. Even these minor things are also radiation. We try to explain to the patient that,
Okay.
ma'am, I won't go outside. You're telling sunlight. I never go outside. Why you're telling like this? My husband goes like from morning to evening. He's fine. So if you're sensitive, and if you're at least sitting before the screen, TV screens, like television screens, how much ever they tell that it is no UV protected, that and all, but minimum radiation will be there. So minimum radiation can be there from anything. First, these 2 points I wanted to clear. Then next, what is sunscreen? So basic, you need to understand sunscreen is something. There are two types of sunscreens: physical blockers and chemical absorbers. One thing you see in cricketers, like best example, when before you used to see all these players in test matches, whitish, they used to apply whitish, full white.
Yes, yes.
The zinc oxide, these are physical blockers. That is, it directly forms a layer, and it will just stop just go sunlight to go inside. In the most common areas, they apply like this nasal bridge. They apply, no, generally. I think everybody knows this.
Right.
Me, I don't watch cricket much, but still I remember seeing this in my younger days.
Yeah, yeah.
Second one is what we use commonly, chemicals, chemical absorbers. These they apply, they mix with the skin, they form a minor layer that which is not visible to outside, and they absorb the radiation, and they won't allow them to go into the skin and cause the change. They will absorb it, but not harmfully affect the skin. So, and a second note, everybody has SPF 15, SPF 30, SPF 45, 50. What is this? SPF is nothing but sun, sun protection factor. Sun
Okay.
protection factor is nothing but if I am not applying anything on any sunscreen on my face or you or us, and we go into sunlight, after 10 minutes, if I get tan, it takes 10 minutes for me to get tan. Let's imagine, I'm just giving an idea. If I apply a sunscreen and then go, it will take 1 to 2 hours for me to get tan. So that protection factor, without applying and with applying, it is a mathematical formula. Just you need to understand that SPF sun protection factor is that even after applying your sunscreen, if you go to into sun, only particular time it will give you the
Protection.
protection. That protection factor is for 15, 30, 45, 50, something like that.
Okay.
This we will select based on, here comes like a type of radiation we are exposed to. Here it comes as a role. So one housewife, homemaker comes to us, and they tell like, normally I'm not doing so much of work outside, but still I'm getting, then we will give her a SPF of 30. That should be enough. But a main patient comes like, ma'am, I go out in the morning, full like in the sun, I travel, I go to my office, something like that. Then we will tell, okay, SPF 50 or something like that. And small kids, a vacation they are going, children, like somewhere in the beach or something like that. So sometimes we'll tell SPF 50. So based on the patient and based on like what type of radiation exposure they have, we will decide the sun protection factor. And any formulations in sunscreen also, gels, creams, lotions.
Mhm.
Based on the type, here comes the role of type of skin. So you're telling if it is
Okay.
a dry skin, then you'll give a lotion preparation so that it will be little creamy and forming.
Exactly.
Already oily, I don't want to put lotion on that, so it will become full oily and they'll get acne and they'll come and ask me. So
Uh,
then put some gel formulation which will directly evaporate on the, like it will easily evaporate and form a
mm.
mild layer. So based on the formulation is also important.
Right. So as per our skin type, we can choose the formulation, whether to go for gel or lotion, etc. But to choose the SPF, we need to look at, what is our exposure to the radiation. Now, you said that, not only sun, but all the other light sources like LED, lights, or I'm working in front of a laptop or mobile. I'm continuously working on a mobile. So
Yes.
these rays are equally harmful for our skin. So that means even if I'm not going out, because normally people say that, okay, I need to go out or I need to apply sunscreen. But now as most of the people are working from their homes, you're saying that even if you're working from your home or you are inside your office, etc., you need to apply sunscreen regularly.
100%. That's we have to apply. And see, the point is, when one more thing I would like to say, in Western countries or something, they don't get tanned. If you're very pale, you get burned. You can see
Hmm.
among your friends if they're very pale, when they go into sun after playing, they get red. They get burned like something like that. But
Right.
if you're British stones like me, we get tanned. That then that point nothing will be there. Next day you can see the blackish tan type of thing on our face. So for them, the tan is not painful or itchy or burning. But burning for fair people, it is burning, so they'll always apply. So Western countries and all, they daily apply sunscreen. Without sunscreen, they never go outside. But as
Right.
based on, like, we don't know from childhood, we are not taught. Like we didn't our parents, mothers didn't teach us, and we maybe, I think it's better if we teach our children. So coming
True.
out nowadays, the radiation is increased so much, and we know how the environment. We are daily we are hearing from various sources that the environment, like temperatures are getting high, and all these things. So it's even if you're sitting at home, you're not doing anything. Getting up and after your bath, nicely wash your face, applying a nice sunscreen based on your like I told you, not everybody should use high things, and based on your sun's type of skin you have to select. And if you apply, definitely you can see this like the look on your face after few months. If you use like this, you will definitely see the original color without the tan and without the blemishes. You can see
Mhm.
definitely there will be a difference. So 100% everybody, even if they think they're sitting on the screen or anything like that, they have to use sunscreen.
So, no excuses. We have to use sunscreen regularly, daily, and again, we need to reapply it, right, doctor?
So
Reapplying is
yeah.
equally important.
Yeah, next point. See, applying sunscreen is not very easy. I can tell, but I just want to be clear. If you really want 100% results with your sunscreen,
Hmm.
there are few things you have to follow.
Okay.
So when you apply a sunscreen, if your day starts at around 9, like you'll be going to at 9 o'clock, you're going into the like work or something, auto, bus, whatever it is, school bus, the kids, anything. At least by 8:30 or 8:15, you should apply your sunscreen and it should get dried. So it will,
Okay.
because it will take 20 to 30 minutes to any range, any high-end sunscreen also to act on your body. It will take 20 to 30 minutes. So first
Okay.
point is, if you're thinking that you'll go, like I'll go in a half an hour outside, it's better. Or like if your day starts before at one point, half an hour before you have to apply, and
Okay.
apply generously. From easy thing I can tell that a teaspoon will be there, no? Like almost small teaspoon amount of sunscreen would be required for whole your face and like this area. Okay,
Okay.
generously, nicely apply, let it dry. Then you can apply your powder and
Mhm.
your whatever daily routine what you apply, you can apply. Nothing, no issue. And then second part, any sunscreen, maximum 3 to 4 hours, and few companies like few are there, but based on their formulations, maximum up to 5 hours. So after every 3 to 4, if you think average 4 hours, you have to reapply your sunscreen. You have to reapply your sunscreen. And one more thing, if you were sitting at home, suddenly you thought of going to shopping or something, morning you applied your sunscreen, it's almost 3 to 4 hours, again you're going outside like at 1 or something, that is when the sun is at its peak, so again you have to apply. You can't think it's 4 hours is not over like that. So I mean, it is not something which goes inside and it will change your skin. It is something which acts as a layer. So whenever the layer goes, you have to reapply. That's all. It's not that I'm applying daily. Why is it not changing my skin? It's nothing like that. How long you apply, that much time only you will have your protection. After 1 month, you stop it. Again, your skin is normal. No protection. That's all. And if you're going to swimming, now okay, I applied beach vacations, something like that. You have to, when you buy your sunscreen, it will be like a water resistant, very water resistant, something like that. It will be written on that.
Mm-hmm.
So water resistant, it is nothing but if you drown whole yourself like in water for 20 minutes, that is one session you can take. Few sunscreens will give you for 2 sessions. 2 sessions is like 40 minutes. Even if you drown, it will give you protection. After 40 minutes, you come outside, you just wipe again, apply, and go and enjoy. Few things very resistant, 4 sittings it can come. That is 80 minutes, it can give you protection, like after going into water. So like that based on, see, it is like your, according to your skin, according to your purpose, according to your exposure of radiation, you have to use. There is no particular like 1, 2, 3 rules for sunscreen application. It changes according to your requirement. That's what I want to say.
Right. Meanwhile, I'll also take some of our viewers' questions, Doctor. We have Jana Mishra asking, can melasma be permanently cured in teenage?
In first of all, teenage, you're getting melasma. I think it's better you get checked with your dermatologist. It may not be melasma also, because in teenage it's not that common. And second, okay, if you're very sure it's melasma, you can't. Melasma is not something like a disease. See, for example, diabetes. It's not a, like it is. It's a disease. I mean, it's not something which is curable. You take your medicine, it keeps it under control within your body. You can have a nice and happy, healthy life until unless it's happy. I mean, you're careful. And same thing with melasma. Until and unless you're careful, you're using all these sunscreens and the doctor prescribed applications like that you're using, you can definitely keep it under control like a normal skin. Nobody will know. But once thinking that okay, it's gone, and now I'm good, and if you stop using it, definitely it will come. I don't think there is anything, any big treatment which can like stop, like cure completely melasma. Maybe the relax time period between each interval may be increased. Means after stopping the sunscreen 1, 2 months, you may be fine, but third month again it will come. It's like that. It's not like maximum. This gap may be increased because of this whatever you're using, but it will come. If you have a tendency to get melasma, it will definitely recover. So you should.
Okay. Right. And doctor, other than sunscreen, what can we do to protect the skin pigmentation? Anything that we can do?
You can something we are doing only, and otherwise chemicals will be there that we will. I can't tell it like, because it's not like normal product. Now if I tell anyway, people will go search in YouTube. They'll buy on and they'll buy. But there are depigmenting agents, definitely. So along with the sunscreen, we'll give you depigment. See, sunscreen helps us to prevent further like pigmentation.
Okay.
Whatever that will come down, no, patient should be happy. So for that, I'll give few depigmenting agents that nighttime you should apply over the day. That will help with the already existing lesions will come down, and by that time the sunscreen will start acting, and further will come. And something else you can do, just be careful if you have tendency to get melasma. Like once you are a patient, once you know you're getting, whenever you go out, just try to like use a big umbrella. Gents can always, when they're going on bike, wide brimmed caps will be there, no? Like
Right.
wool style caps, like little longer. That you can use, that will form a protection. And ladies can always use tie their suggestion from
Uh,
our side.
right.
We don't go in the odd hours, that is like 11, 12 to 3, 4 o'clock. Just avoid that time, try to stay indoor. If you have to go, then double protection with sunscreen like that. So that are small things you can do.
Right. So sunscreen is there, plus you can use some clothing to protect you from the harsh sun. I will pick few more questions, doctor. We have Abhi Singh asking, can I wear makeup that has sunscreen in it? Now, nowadays we have moisturizers with sunscreen, makeup products with sunscreen. Are they, I mean, equivalent to wearing a sunscreen?
Yeah, see, this is a very common thing which my patients also ask me. Makeup products are anything now. Many things like many brands where now they are coming with moisturizer with sun protection, moisturizer with sun protection. But we don't know the ingredients of those. Like if you turn your makeup product or anything, there will be hundreds of things. The proper amount of each thing also won't be there. So I am not telling they won't work. I am telling I can't tell until unless I see like the ingredients is proper, like whatever what amount of what is there and however the SPF is derived, we can't comment on that. So I keep telling, but patients still insist, madam, I go for higher brands like costlier brands. We can't comment on that. These answer people won't like it, but we can only tell if I am prescribing some medicine. I know what is the ingredient. It will be written in our the box itself. What is there? How much is there? So we would prefer like that things. But if they insist on using that, we'll tell them to use it and see the changes if it's working. They only will come and tell after one, ma'am, it's not working or something like that. If it really works, great. But we can't comment on it.
Okay. One more question, which is very common with people, and that is one of the biggest reasons people stop, which is stopping people from using sunscreen. Surbhi Shukla is asking this question. If I wear sunscreen often, can I get a vitamin D deficiency?
No, no. Yeah, very good points there, asking actually. Yeah, no, no, nothing like that. See, sunscreen you apply on the whatever sun protection factor you are using, that is not blocking all radiation. The harmful radiation with particular wavelengths will be blocked. So it's not that vitamin D level insufficiency will come. So nothing like that. Please take the thought from the. I have to explain. I have to explain so much now. Chemically, what is there in sunscreen? So I can't personally. You can definitely, if you want much clarity, not like in this session, you can personally go and visit a dermatologist, and they'll tell
Right.
you 100% there is nothing like a vitamin deficiency like you will get. And one more point I would like to add. Generally, all this like we sit in however we are working. I sit here and work. Normally, also we are not getting exposed to sunlight that much for vitamin D.
Right.
The only source. But sitting here, we are getting affected because of this radiation. So
Right.
there is a difference. Nothing like that. Just take it out of your mind. Nothing will happen like that.
Exactly. So I'm sure, Surbhi, you have your answer now. Asha Jain is asking, can I be allergic to sunscreen?
Yeah, definitely. There are few like there are some tens and twenties of chemicals which with different combinations we are used. If you take from 1, 2, 3, 4, 5, 6 like that, if 20 ingredients are there, 1, 2, and 4 one sunscreen, 1, 2, and 8 one sunscreen, 3, 4, 6 like different. It's a thing of formulations. Different companies produce different kinds of this ingredients mixture and form sunscreens. So it's there is always a chance that you may be allergic to any of one of the ingredients that is there for any cream. So better if you think like whenever you want to try a sunscreen, it better you can apply it over see generally any cream, not only sunscreen, anything you want to apply behind the ear or on your forearm or this side. You can always apply, leave it for a night and see if any like redness or something like that is occurring. Even then also then you start applying on your face. Then also for 48, once you apply, wait for 48 hours. If nothing is happening, then it's okay. But still, if you feel low, ma'am, I'm getting little dryness, or there I saw the patients. For them, this I told you, like only physical blockers will be there. They will just form a layer. It won't go inside. Not no chemicals. Minimum chemicals will be there. That can be helpful, and that you can ask your dermatologist. You can tell them definitely that, ma'am, I'm using so and so, but I'm having little allergic reaction. So can you tell me anything which with less chemicals? So there will always be physical sunscreen. So can you use that?
Right. So we can always do a patch test before going for sunscreen. Now, another thing, doctor, because sunscreen, as you mentioned, we need to use sunscreen daily, regularly, and keep on reapplying it for a certain amount of time. Now, many a times people are scared that I'm using sunscreen for almost, most of the time, as my most used product maybe is a sunscreen now. Can it be toxic to my skin? Is it going to harm my skin in long run?
So in long run, your skin will be very good actually, and you will age very late than others, definitely, because there is two types of aging. Like for any skin, one is age like like what our age, like 30, 40, as we age, we age. Then is photo aging. Second one is photo aging. Photo aging is someone, if you see someone who go into sun more, they will be aged. Their skin will be aged more, like they appear older for their age. Definitely help you. Nothing major gross side effects will be there for any sunscreen.
Exactly. So don't stop yourself from including sunscreen as your daily skincare routine product. Use it daily if you have not used it yet. Please go buy the best sunscreen for your skin as per your skin type and your work, style, so that you can know what's your exposure to the radiation. But start using it right away. We have Shushila Agnihotri, doctor, who's yes, one more thing. Yeah, doctor.
See, all these things, if the patient himself or herself think why to use, it's okay if I get pigmentation, then it's their wish. This is not mandatory that something will happen due to your inner, nothing will happen inside your body. This is for appearance. So there are few people, when because of all our discussion, they may think what will happen, I won't apply, nothing will happen. If you maximum create some pigmentation, it's okay, then it's okay. It's your wish. You want to look good, you don't want the pigmentation on your skin, then this is
Exactly, right. Yeah, but normal tendency of people is that they want to look good and spotless.
they may think that what will happen, okay, I won't use, what will happen.
True. So it's not life threatening, it's not going to damage you in any other way, it's just that the appearance will get happen. Okay, so now I'll take this question of Shushila Agnihotri, doctor. She is asking, what is the basic lifestyle routine to take care of skin? I'm working woman, and I work 9 hours in a day, so how to keep my skin healthy? What should be the minimalistic beauty skincare routine?
Whenever, that's what I know. You can use a normal SPF 30, where if your skin is dry, or you can use a lotion or creamy formulation. If it's oily, you can use a gel preparation. And just before, like after getting up, as a daily routine, after you bath, at yourself dry, you can apply nice sunscreen. Wait for half an hour, then you can apply your powder, like whatever makeup you want, and happily go and work. After you're staying indoor only, so mostly 4 5 hours it will stay, if you're not sweating or something like that. And after again at lunchtime or something, you can apply again.
Right.
Yeah,
So,
basically, and apply, and after 5 6, no need to apply again. Yeah,
right.
somehow no need to apply.
Hmm. Fair enough. And doctor, as you also mentioned that people come up with all kinds of excuses. They'll see that sunscreen makes me sweat a lot. Sunscreen makes my skin more acne prone. I get a lot of acne after using sunscreen. I'm getting tanned after using sunscreen. That they have all kinds of excuses. What's your take on that? What would you like to tell them?
Yeah, I don't want to like hurt the others' feelings. Also, it's not excuse, but sometimes it's true. If Yeah, that's what I'm saying. That's why here
Right.
comes the role of a dermatologist. See, if this is not there, I can definitely tell you go and pick some sunscreen from your pharmacy or anything. You can apply it. No, but I tell you to go to a dermatologist because based on your skin, they'll know. Like if you're acne prone skin, they will give
Mhm.
you something which is non-comedone that is light. It will be light, so it won't block your pores, so that you won't get acne. So if
Mhm.
you're oily skin, they will give you gels. If you're dry skin, they'll give you one kind of thing. So it depends. I can't like generalizedly say like what the sunscreen for each person, but it is definitely based on your skin. It's better to like a person see like a certified qualified dermatologist to check your skin and suggest you some sunscreen.
Right. So in case you have any doubt, any problem, please go and talk to your dermatologist.
Even for me, initially when I use sunscreen, I have an acne prone skin. I got acne also. So I changed the formulation and tried to see like which one suits me better. And with the help of my then seniors, like my sirs and all, then I thought, okay, this is good for me. So like that, you have to little work on yourself if you're very sensitive and acne prone skin.
Nandita is here asking, can I get a higher SPF by adding SPFs from two different bottles?
No, that won't help. That is you don't use like that because that will be over coating. It will block your pores. Even if you're not acne prone, then you will get like your face will be damaged. Don't use two. Why do you want to use two? You can just happily take a nice SPF, higher SPF directly. It's the easy single layer application. It will dry and it will be airy. It will be light. Don't use like two
So
SPF.
2 plus 2 calculation is not going to work here. It's better to go for, if you want to go for a higher SPF, go for a separate different bottle of sunscreen. Doctor, I would also like to ask you that people are so, obsessed. They have this obsession for a fair skin. And there are people, especially in our country, who use a lot of fairness products and, to look fair. Plus, there are people, if they have a skin problem, they won't go to the doctor because we have this tradition in our country to treat you through the kitchen
Yes,
with some home remedies.
yes.
So, what's your take on fairness creams? Because I've heard that people, after a certain time, kind of get reacted with them and then get tanned or have melasma pigmentation, etc. Plus, your take on home remedies as well.
Yeah, see, first point is the running behind fairer skin is there in our culture. I don't know why, and because we are Dravidians from our base, we are rich. It's not
Right.
like something we are very fair. So one thing I always counsel my patients, like my friends, my circle, that whatever tone you have, whatever color you are, if you make that color, you should maintain your tone, not your color. So
Right.
if you're very fair and you have full acne and if you have dry skin, you won't look pretty. Even if you're beatish and you apply, if you have a nice glowing skin, it is like it looks good. They look very beautiful. And now I think we can say we are very positively moving towards this because many of your our
Exactly.
heroines also. I don't know if I can say because again people may get offended, but there are very British toned superheroines now in our Bollywood, Hollywood, everywhere. So that's okay. Now, if the color doesn't matter, it is always the tone of your skin, the clean you have to. If you maintain your skin, that will be fine. And because the situation is actually bad also, like both ways. We get to see some few parents like after baby they get a 10 days old small baby and they tell madam when the baby is born it's very pale. 10 days it became dark, do something. What will we do for a 10 days baby? And they are not bothered about the health of the baby. They're bothered about the color. So situations are bad. But definitely I can see the lightning from one side. I think youth and our generation is changing.
Right.
Definitely here more the grandparents are more concerned than like our generation, definitely they're changing. We can see the difference because now people are not asking so much. And home remedies also, we can't just tell they're all bad, because I can't grossly say they are bad, because earlier they worked, but now I am telling that whatever home preparations we are getting, those things itself are not natural and organic.
Exactly.
Even the fruits which we get, the vegetables nowadays, why are they running behind organic without milk? We don't know which is, even the haldi, kumkum also, they are not good. Everybody is getting allergy for kumkum. Everybody is getting allergy for haldi. Try to convince in nice traditional religious mother not to apply healthy is very difficult, especially in Andhra. Like every mother, like everybody, like applies nicely for the face, and like
Right.
that is a nightmare for us to convince them it's not working. So if you're using home remedies, I don't think, like, 1 second, they should be very good source to use. That's all I can say up to that much.
Exactly. And Doctor, as we are moving towards the end of this session, any take away message for our viewers?
Yeah, definitely. Uh, Today we are talking mostly about melasma, but this, whatever I said is not only for melasma also. I am telling for different kinds of pigmentation, blemishes, whatever we like daily we see on our skin only. Sunscreen something helps us before before the things to become large, before it becomes problematic. At the ground level, if you start using sunscreen, you can up to 70 to 80% you can control all these things which occur to your skin. But even then, if you have any concern, you can definitely come and see a consulted dermatologist, which will require further interventions. And even so application of sunscreen also should be like half an hour before going to your daily routine, and reapply after every 4 hours, and try to avoid the peak times like 12 to 3 or 4 o'clock, and cover yourselves with proper clothing when you're going outside. And if you're prone for photo damage is nothing but sun damage. And when you're going into water vacations or something, always carry your sunscreen, reapply it whenever required. And if you think you're getting allergic to any sunscreen after using, don't worry, there is always a large number of formulations, something or the other your dermatologist can find which will help you. And Yeah, just take proper care of yourself. That's all.
That was a very, very informative session from you, Dr. KNS Sailaja. Thank you so very much for your valuable time. We
Thank
really look forward for many more such sessions for our viewers in coming times.
thank you.
So viewers, we all are different. We all are, different in many ways. Equally, we are different in our skin tone. So it's important to accept what we have. Just we can, keep it healthy. So follow what Dr. Sailaja just have briefed us and stay healthy. That's really important. Thank you so very much, viewers, for your participation in today's session. We are available on Facebook, Twitter, Instagram, with name Beautiful Spotless Skin. Stay connected to our Beautiful Spotless Skin page. Thank you. Have a great day ahead. Bye.